আমি ক্যানাডাতে থাকি। আমার ইন-লজ ক্যালকাটাতে থাকে। আর we have been associated with Care Continuum for now almost 4 years, 4 to 5 years I guess. প্রথমে আমার মায়ের জন্য she was really taken very good care of. তারপরে আমার শ্বশুর মশাই he departed last year, and now Care Continuum is taking care of my mother-in-law. Our mother-in-law, she suffered from a stroke in 2019 February, and then she had dementia. আর এখন শ্বশুর মশাই যাওয়ার পরে the situation deteriorated a little, but through continued care and through movement physiotherapy, she has recovered so much. So there are 2 sessions of movement physiotherapy that happens for her. তো ওরা মাকে দিয়ে পুজোর ফুল দেওয়ায়, মালা গাঁথায়, which helps her to develop her motor skills. তারপরে পেন্টিং করায়, ড্রয়িং করায়, which helps her. Then রাখি ছিল, she was encouraged to make a রাখি, and then সবাইকে বাড়িতে রাখি পরানো হলো। যে Miss Monisha, যে movement physiotherapy করায়, she's always in regular communication with me, and she advised me of more frequent sessions with between my mother-in-law and my son. And after we started that, we saw quite a significant progress in her dementia. Now she is doing very well for herself. আর আগে 2 session হতো, and after she was doing well, Miss Monisha advised of reducing her session to 1 day, and now we are doing the session for 1 day, and she still continues to benefit. Our mother-in-law is always in touch with the doctors of Care Continuum. They have always arranged doctor trips, nurse visit, doctor visits at home, constant encouragement provided to her, regular communication is kept. They always advise me of her conditions. আর যেটা আমার সব থেকে ভালো লাগে, that when I make a call to any of them, whether it be the nurse supervisor, Miss Prabhati, or the current coordinator, Miss Rituparna, they always respond to my calls. Then nurse jara ache Care Continuum, they are also doing phenomenal, খুব caring, খুব affectionate, they take very good care. I am truly blessed to be associated.
Hello, my name is Deb, and I'm recording this video for World Alzheimer's Day from my home in London in England. My mother is 90 years old, and she lives alone in Kolkata. About 6 years ago, she broke her hip, and following that operation, she became less mobile than before, and she was confined to 1 floor of her house. She has not been able to go up and down the stairs or leave the house since then. About 2 or 3 years ago, I started noticing that she would repeat herself during our weekly telephone conversations. And what I thought was initially forgetfulness was evidently much more serious and pervasive. Eventually, with the help of a neuropsychologist, we came to the diagnosis of Alzheimer's disease. It was a devastating diagnosis to come to terms with, mostly for me, because Alzheimer's robs you of the people that you hold close to you and the memories that you share with that loved person. For my mother, she became vulnerable, and like many other people in this situation was taken advantage of by some people who were close to her living in the house. This compounded the impact of Alzheimer's on her, and it became clear that she needed much more hands-on and reliable, trusting care than I could provide at this great distance. That's where Care Continuum came in. I found them on one of my visits there, and I met with some of the doctors, therapists and nurses who work in the team. I was impressed to begin with, but my opinion has greatly strengthened, I think, over the year or so that they have been working with my mother. As well as the routine medical checks, the work of Monisha, the movement therapist, has been really eye-opening. Monisha uses a combination of music, dance, memory recollection, and other exercises to stimulate. And my mother has really come out of her shell. She has transformed into a younger person, someone that I recognize from years ago. And it's from that exposure and that interaction that I've realized how important social interaction is to the identity of a person, and how much of her personality had been lost through that human isolation. My mother now can stand on one leg. She can walk around with a stick, and she's far more mobile than she was a year ago. She's also much more animated, she's more interested, she's more engaged, she's happier. She looks forward to all the visits by the team. She's writing a journal, she's drawing pictures, she's listening to the radio. She lives a much more fulfilled and fulfilling life than ever before. And I commend the agency, Care Continuum, and the activities of movement therapy to anyone who shares a life with someone who has Alzheimer's. So I send my love and blessings to all the community out there, and wish you the best for the years to come.